Depression affects nearly 1 in 15 Americans, but finding help and the right treatment can be confusing. Joining me with a few options are my guest psychiatrist, Dr. Stephen Ornish, professor at UC San Diego's Department of Psychiatry, and Graham Cohen, author of the book Back from the Brink, his personal story of battling 5 years of severe depression and several attempted suicides. Welcome to Evening Edition.
Thank you. It's a pleasure to be here.
Dr. Ornish, what are some of the signs and symptoms of depression and how are patients diagnosed?
Well, the most common sign is really a sad or depressed mood. And when you talk about depression, in terms of talking about a major depression as opposed to the normal sadness that we can all experience day to day. And the most common symptoms are a sad, highly depressed, sometimes irritable mood. It can present with anger, changes in sleep, changes in appetite, low energy, changes in concentration, feeling either very run down or feeling very agitated, and suicidal thoughts or feelings. Those are all the hallmarks of a textbook major depression.
And we'll come back to how it gets diagnosed because I have another question about that. But Graham, your book recounts your 5-year journey, I should say, with severe depression and several suicide attempts. How debilitating was this depression for you?
Incredibly debilitating. I couldn't sleep. I had low energy levels, just dark thoughts. My mind worked more slowly. In a very short time, I lost my job, a 20-year marriage, so pretty debilitating.
Your book also begins with a suicide note from one of your attempts. Did your family and friends know the condition you were in, know that this was a depression?
The first suicide attempt they didn't know because I felt so ashamed. I kept it to myself. I didn't reach out, and that was a huge mistake. The second time was when I wrote that note. It was after really prolonged depression. They did know, but they didn't know that I was going to make that attempt.
Dr. Ornish, I understand the first point of contact for many patients is their primary care physician. What should a primary care physician do if they suspect someone has depression?
Well, primary care physicians are commonly on the front line. That would include family physicians, internists, gynecologists, and pediatricians. And the first step is really to make an appropriate diagnosis, make certain there's no medical cause of the depression, such as low thyroid or even Parkinson's disease, as we saw with Robin Williams, and then to initiate antidepressants for the more moderate to severe depressions, and to make a referral to a psychologist, to a psychiatrist, to a mental health professional for psychotherapy.
Do most patients need a referral to come see you? And if they think they do, to see a psychiatrist, I should say, should they ask their doctor for one?
Well, I think patients need to be proactive. So if the primary care physician is not making the referral, ask to be referred to a psychiatrist. Psychiatrists are the most well-trained, qualified mental health specialty to treat major depression, particularly the more moderate to severe ones. You can also ask for a referral to other mental health specialists, but the most qualified one to treat a major depression, particularly, again, the severe ones, are psychiatrists.
And they can also prescribe medication, which is a difference there. Now, Graham, you surveyed over 4,000 people living with depression or bipolar disorder. From that survey emerged your top 10 list of coping mechanisms or effective ways to deal with depression. Highlight a few of those for us.
Well, I think the top three are to share it with someone you love or trust. Having that emotional support is paramount, and the compassion side of things were about 5 of the top 10, so that's really important. It can come from support groups as well. The second thing is, of course, to see mental health professionals, but people that have experience in depression. Unfortunately, a lot of primary physicians don't have huge experience, and so getting one that does know this area, and if necessary, seeing a psychiatrist. Exercise. 30 minutes brisk walk was just seen as really important for coming back, and so they'd probably be the top 3 that I'd focus on.
We'll have to end with this, Dr. Ornish. Medication obviously is a treatment of choice for a lot of people with depression. How do you determine who needs medication and what kind of follow-up is needed if somebody, either their family practice doctor or a psychiatrist, gives them an antidepressant?
Well, you determine by the nature and extent of the depression. Again, medication we typically reserve for the more moderate to severe depressions, and you determine who needs it by the subjective symptoms that the person is manifesting. For the milder depressions, those can be often treated with psychotherapy as well as lifestyle changes to complement it, as Graham had indicated. In terms of follow-up, once medications are prescribed, they typically are very well tolerated. Usually the physician or the psychiatrist will see the patient and follow up within a week or two, and then subsequently will stretch out the sessions depending on the response.
All right, well, we have to end it there. There's a lot more resources on our website, kpbs.org. Stephen Ornish, Dr. Stephen Ornish, and author Graham Cohen, thank you very much. I want to let folks know that if you or someone you know is suffering with untreated depression or is suicidal, you can call help, and you can get help around the clock by calling the San Diego County Crisis Hotline, 888-724-7240. That's 888-724-7240.